Assalamu alaikum. This is the medulla oblongata and the pons, the posterior view of the medulla oblongata. Now, starting the posterior view of the medulla oblongata, we start from the median. सबसे पहले जो पॉन्स के नीचे से एक मीडियन लाइन पास करती है आपको नज़र आ रही होगी. दिस इज़ द posterior median sulcus. The posterior median sulcus. Anteriorly we saw that was the anterior median fissure, and posteriorly is the posterior median sulcus. The posterior median sulcus. अब इसके laterally यहाँ पे हम देखेंगे there are two eminences are called the medial eminence. Then lateral to which lies the lateral area. This is the lateral area, and this is the lateral area, and these are two the medial eminences. Then the lateral area contains the vestibular. It's also called the vestibular area because it contains the vestibular nuclei. As you know, there are four nuclei of the vestibular nuclei: the superior vestibular nuclei, inferior side vestibular nuclei, the medial and the lateral vestibular nuclei, that forming the corresponding medial and the lateral vestibular spinal tracts. Now, above the medial eminences, these are some fibers that are separating the medulla inferiorly to the pons superiorly. Separating medulla inferiorly and the pons superiorly, these are the bundle of fibers. This is called stria medullaris. Stria medullaris is basically the bundles that are separating pons and medulla at the level of the pontomedullary junction. Below this median eminence, on the median side, there are basically the triangles. This green triangle having apex downwards, apex directed inferiorly and base superiorly, is this green one is the hypoglossal triangle. The hypoglossal triangle basically lodges anteriorly, यानी इसके ये posteriorly lie कर रहा है ना, तो यहाँ पर हमारे पास होगा hypoglossal nerve का nuclei, the nucleus for the hypoglossal nerve, that is the 12th cranial nerve. Now इसका ये medially lie करेगा और its apex would be lying inferiorly or downwards, and base would be lying superiorly or upwards. Lateral to this hypoglossal triangle lies the vagal triangle. This laterally shown in the lateral area is the vagal triangle. Now you can see the apex lies upwards or superiorly, while base lies the inferiorly or the downwards. So this is the vagal triangle, which contains again the nucleus for the vagus nerve, that is the 10th cranial nerve. So it's MCQ point. There's a hypoglossal triangle lies medially, while the vagal triangle lies laterally, and the hypoglossal triangle ka apex lies downwards and base lies upwards, while the vagal ka apex lies upwards and base lies downwards, or you can opposite vice versa. Now at the junction of the एक point, the median eminence is separated from the lateral area from the line or the limiting line that is called sulcus limitans. Sulcus limitans is basically the line that is separating the median eminence from the lateral area or the vestibular area, which contains the vestibular nuclei. So basically you can see the hypoglossal triangle is basically in the median eminence, while the vagal triangle is basically in the lateral area. So this point indicated by my finger is the point at the junction of the apex of the vagal triangle. This is the apex of the vagal triangle and base of the hypoglossal triangle. This point at the junction of the apex of the vagal triangle and base of the hypoglossal triangle, this point is called as inferior fovea. Inferior fovea. These two are the inferior fovea. Moving downwards, now ये हमने पढ़ लिया median eminence and the lateral area. उसके नीचे एक आपको एक line से separate करती हुई नज़र आ रही होगी. This line. This is called the funiculus sapierens. Sapierens से पता चल रहा है हमें ये separate कर रहा होगा, और funiculus हमें पता है bundles of fibers, जैसे कि हम funiculus पहले भी पढ़ के आ चुके हैं. The funiculus sapierens is separating basically this region from inferiorly this region. Now अभी मैं ये ऊपर वाला मैंने आपको explain कर दिया. This is the median eminence and lateral area or the vestibular area. अब मैं नीचे वाले की तरफ आ जाता हूँ. Now below the funiculus sapierens, the area shaded by the red marker. This red is a very, very important area, that is the area postrema. Area postrema is very important with respect to the exam point of view, the spotting point of view, and also in the medical field. It is very important because the area postrema contains major respiratory centers. Basically, ये medulla oblongata का area postrema is the darkest area of the medulla oblongata. Why it is called the darkest area of the medulla oblongata? Because the area postrema contains the basic vital centers of the body. This is a chemoreceptor center यहाँ पर होता है. It contains a respiratory center and vomiting center. And also an important point, there is कुछ points body के अंदर ऐसे होते हैं where there is no blood-brain barrier or the blood CSF barrier. तो area posterior is one of those in which there is no blood-brain barrier and there is no blood CSF separating a barrier. ठीक है, यहाँ पे barrier नहीं होता, blood-brain barrier नहीं होता, blood CSF barrier यहाँ पे नहीं होता. अच्छा, अब एरिया पोस्ट्रीमा के नीचे हम एक्सटेंड करें तो आपको पता है दिस इज़ अ पोस्टीरियर मीडियन सल्कस, जो दरमियान में लाइन जा रही है. तो यहाँ पे फिर ना ये एलिवेशंस जा रही होती हैं. दिस वन indicated by G, C and this lateral ones. So this is basically the fasciculus gracilis medially, then a bit more laterally lies the fasciculus cuneatus, and the most laterally this lies the tuberculum cinereum. The tuberculum cinereum. Now I will explain individually. आपने तरतीब याद रखनी from medial to lateral, fasciculus gracilis, fasciculus cuneatus, and the lateral most the tuberculum cinereum. The fasciculus gracilis above ends in the form of nucleus gracilis, then correspondingly fasciculus cuneatus above contains the nucleus cuneatus, and lateral to which lies the tuberculum cinereum. The tuberculum cinereum is basically the swelling for the trigeminal. हमने ट्राइजेमिनल नर्व पढ़ी थी, दैट इज़ अ फिफ्थ क्रेनियल नर्व. उसका एक दरमियान में एक प्रिंसिपल जो है वो गैंग्लियन, एक बड़ा सा जो है ना गैंग्लियन का इंप्रेशन आ रहा होता है. उसका फिर ऊपर एक मिड ब्रेन में पार्ट एक्सटेंड कर रहा होता है, दैट इज कॉल्ड मेसेंसेफलिक पार्ट, बिकॉज यू नो मिड ब्रेन इज ऑल्सो कॉल्ड मेसेंसेफ्लॉन. सो द मिड ब्रेन, द पार्ट ऑफ द ट्राइजेमिनल एक्सटेंडिंग इन द मिड ब्रेन इज द मेसेंसेफलिक पार्ट, एंड द प्रिंसिपल के नीचे फिर जो नीचे स्पाइनल कॉर्ड के एक्सटेंड कर रहा होगा दैट इज अ स्पाइनल पार्ट. So this basically tuberculum cinereum is a swelling due to the trigeminal, और उसके नीचे ये फिर spinal part का extensions दिखाएंगे जो कि जा रहा होता है up to the C7 तक जा रहा होता है. ये cervical vertebra 1 segment C1 2 तक जाता है और below to which further extend नहीं करता. हाँ, एक चीज़ मैं बताना भूल गया कि this whole area is called as the open part, and this below which lies the closed part of the medulla oblongata. Medulla oblongata हम इसका भी division कर लेते हैं. The above lies the open part of the medulla oblongata and below which lies the closed part of the medulla oblongata.